Hi everyone, this is Dr. Sandeep Sharma here, and we have a very special guest here. Why am I using this very special? Because he's also technically my junior. So we have Dr. Malav Thakkar, who has got rank 1 in INI super specialty pediatric hemato-oncology. Yes, you heard it right, it is rank 1. And as I said, he has done his MD Pediatrics from my alma mater, that is APC, Advanced Pediatric Center, PGI. So it's my honor to welcome Dr. Malav Thakkar to this interview. Congratulations, Malav, and welcome to this interview.
Thank you, sir. Thanks a lot. Thank you, sir. Thanks a lot.
So before we start with the interview, would you tell our viewers about your background and where you did your UG and PG? I've already told. So please enlighten.
Yes, sir. So I was born and brought up here only in Ahmedabad, Gujarat. So after that, did my UG from here only, from BJ Medical College, Ahmedabad. And like seeing at videos of interviews during my UG third year, final year, I got to know about PGI pediatrics. So I was a little bit obsessed with that. Like I started there. It needed a separate preparation that time. You had multiple choice questions. You had to go there and give exams. So I prepared for that, and luckily I got there in my first attempt. So did my MD pediatrics from there. And I also remember calling you before my MD pediatrics before joining, and you told you will get there. Your rank is good, and don't worry, you'll get there.
Yes,
so that's how the journey began.
I still remember it. You had got rank 23 or 24, if I'm correct.
Yes, sir. 23.
23. Great. So it was pediatrics by choice, and now it is pediatric hemato-oncology by choice.
Yes.
So you'll be coming back to Chandigarh again. Back from Ahmedabad to Chandigarh. So that is your karma move. Huh? So good. Great to hear that. So let's now talk about points which will be beneficial for all those future aspirants who are looking up to you. So first thing, was this your first attempt, or you have given the exam previously? And
no, sir, this was my fourth attempt, sir. Actually, I gave when I was I passed out in June 21. Okay. So that was my first attempt. So last year December was second, then May was third, and this was my fourth attempt.
So you have given 4 INI SS exams. So you must be knowing better than anybody else about how the pattern is evolving. So do you see any changes in the patterns of recent? Because a lot of other toppers also, they have shared with me in person that, sir, the exam is becoming a bit different compared to the older papers. Please throw some light on that.
Yes, different in the sense like it is, if we see NEET also, like it is now becoming more and more clinical and more conceptual. Like the exam is not only if you read 6 months and you will get you'll crack the exam. That I think that those days are gone. So whatever you do in your 3 years, like I can still remember in few questions like what we discussed in rounds or heard somewhere, like they will click somewhere in your exam, and every question is of same marks, so those will carry equal weightage as something you have read so well. So the exam is definitely becoming more and more clinical. And INI, I feel that definitely specialty you have to go through in detail, because like around 60 questions will be from specialty. So without like saying it goes, like you have to be very well prepared, but we should not ignore general.
Yes.
I'll stress more on that, because for me I realized that that is more of a game changer than, because we tend to read super specialty from the same source, we can remember the same thing. So getting a same marks, like you will get 45 around questions right from 60, if you, so that will be similar. But if you ignore general, like that 2-3 questions can make a difference. And in INI we know the markings 1.3 marks. Like I remember when I got second rank the first time, my difference was 1.3 marks. So we know one question difference that can make a lot of difference. So yeah, I'll specifically stress that even if it is 20 questions, general is very important.
And what resources did you use in specifically for hemato-oncology?
So for hemato-oncology, sir, I started by reading Lenzowski. It is a good manual to start with. It is a easy book to read.
Yes.
And then when I had time, I read Pizzo and Poplar. So
Okay.
that is after reading Lenzowski, you can go into a bit detail about the theory, because now a lot of questions in oncology per se are more of genetics,
Yes.
pharmacogenetics, genetics,
Mhm.
drugs. Obviously drugs will be monoclonal antibodies,
Mhm.
so mechanism of action. So this all dynamics you need to know in detail about oncology. So those, for that you need to go one step beyond.
Yes.
So
So,
for that I read.
yes, yes. So, Dr. Malav, I have a specific doubt related to pediatric hemato-oncology preparation. Like a lot of students, they have always have this doubt, that if there is a question being asked in the exam related to, you have given the exam 4 times already, so you know it better than anybody, that if a question is being asked on a particular protocol of a pediatric malignancy, you know that there are significant differences among all these protocols, and even aims and pgi protocols do not match with each other, right? In
Yeah, yeah,
a lot of aspects,
that is,
you know the inside story, they don't match. In
yes,
hemato-oncology
yes,
they don't match at all. So
yes, that
so,
is true.
so what is your opinion on that? Do those differences
So
matter in the exam? And if they do matter, like what are the sources that you would recommend to the students for those? It's a gray area actually.
yeah, yeah. So, sir, first of all, I will tell that you should not worry about those things. So they design the question so nicely that your answer will be similar if you follow any protocol. So
Correct.
I'll give an example.
Hmm.
So if you see for Wilms tumor, so Wilms tumor, we know we have COG and SIO, both the stagings. So
Hmm.
they will ask that abdominal lymph node positivity is which stage
Hmm.
in COG. They will mention the word COG or they will mention the word SIO,
Yeah.
but that is same. It is stage 3 for
Correct.
both.
Correct.
So we get confused, but if we'll read it, we get to know that no, they are asking the same point, but they are just confusing it by giving us a term as COG or a term as this protocol. But the concept is same, because in both it is stage 3. And I don't think they are going so deep that you need to know at this level the differences in protocols. And they don't expect also. They expect you should know the staging properly, and that staging is same in both. So I think that is what they expect, and we should not panic on memorizing the entire protocols. That is not possible at an entrance point of view, but we should know the fine points. Like I have seen your lecture only on Wilms tumor, you have nicely summarized the staging, and I think from that is more than enough. Like even if a question is asked on COG, that won't change,
Hmm.
so it will remain the same. So I think we should not panic on protocols or difference in protocols. We should just focus on the concepts, and the answer will be same.
Correct. And the question I always ask every topper every year: how many journals did you read for entrance preparation? Not for your thesis, not for your presentation, for this exam.
Yeah, sir. So I think you. So for every, you should see old papers. You should ask your seniors which are the repeated topics, because so in pediatric oncology, what I found was that retinoblastoma you will have 2-3 questions every time.
Yes.
Juvenile myelomonocytic leukemia, it is a 3-page topic, but you will have 1 or 2 questions every time.
Correct.
So Hodgkin's lymphoma will have every time. So you should read articles of those, and
Hmm.
that too from AIMS or PGI, because questions are designed from there. So it is bound that what is practiced there, they will follow and they will likely ask.
Hmm.
So you identify these topics which are like a frequent repeats, and you might you might neglect them. Like while reading, it is a 3-page topic, you will go, but that small point, like there is a favorite question, like which of the following virus is not included in causing JMML. So
Hmm.
they'll ask this, I think 2 or 3 times of the 4 paper they have asked. They'll give CMV, they'll give HHV, EBV, and fourth is HIV, and HIV is not the answer. This is a frequent repeat. And I've read AIMS article, and they have nicely mentioned it there. So like this is just an example, but there's just a small topic, and if you read it once, you will know it. So
Hmm.
I'll tell that you just find or list some topics which are very high yield, which are very frequently getting repeated, and you just read the articles from AIMS or PGI of those topics, and I think that can help. Like we know that there are a lot of articles, we cannot read all, but just because we know that like tough questions will be asked from these topics, like these are some great topics, and the normal questions like acute leukemia, lymphoblastic leukemia, everybody will be able to answer because everybody will have read those in detail, and they cannot go in depth beyond a certain point in those topics.
Correct.
But these are some topics where they can actually test your reading, whether you have, because it was a small topic, whether you have read in depth or not. So I feel we should identify those topics and we should focus on articles of those topics. That will help more and it will be a high yielding.
And how much important is Nelson?
Nelson, yes, sir. I forgot to mention, like, if we give Hemato Oncology, Hemat first source is Nelson, without any doubt. Hemat is very beautifully given in Nelson. Like, you should read from first word to last word of Nelson.
Yes.
And lot of questions directly come from Nelson in Hemat, especially.
Yes.
Other systems, so I believe if you read general from Nelson, that is done, and your notes are sufficient for general. Like it is a simplified version of Nelson. So I had made those notes last year and continued reading till now. So that was a time saving. But yeah, if you have read Nelson in your MD time, then your preparation will be a lot easy for DM.
Great, great. Also, I heard that this time the general paper, the general part, questions were a bit lengthy, and I don't know about hemato-oncology, but neonatology people, the interviews I took, all of them agreed that it was difficult to finish the paper on time. Like they finished the paper on time, but they could not come back to the questions because the general questions were too lengthy. Was it this? Did you also feel the same thing?
Yes, sir. Yes, sir. So I also felt that the Hemat question, like none of the question was fact based, and even if it was fact based, it was like summed up in a conceptual way. So you have to read those 6-7 lines. You have to form your diagnosis at the fifth line, and then there will be a 2-step or 3-step question related based on that. So yeah, I also felt this time the paper was a bit lengthy. I also finished in last. I remember there was a question on OSI, and I was calculating it till the last minute. So yeah,
Great.
yeah, but it was a lengthy paper this time.
Nice. So, like you enrolled for PrepLadder Super Speciality. So, what all resources of PrepLadder helped in your preparation? And did you give the grand test? Did you give the mock exams? MCQ practice?
Yes, yes, sir. Actually, what I did was last year after I finished my MD, I took the course, and I in like 2 months I made notes of general. Like my target was just to pick up a system and make notes. Even if sometimes I'm not sincere enough in listening those things, or sometimes I'm not fully attentive, still I made sure that I made notes in 1 or 2 months, and then I knew that I only had to add on my notes. Whenever next time I'll read, I'll add on my notes. And simultaneously, next what I did was I solved the question bank, and whatever extra thing was or points or facts was there in question bank, I added it to my notes. So till my last year exam, my second attempt, I had a good notes of general and including the question banks also. And then I used to give the mock exams also. I gave it every time, and it really helped because the questions in the mock exam are also very clinical and more like they are also like more of clinical, less of fact based. So that also gives a simulation.
Correct.
So yeah, sir, that really helped.
Nice.
Because actually what happens is that we need to revise the general topics faster, because the specialty topics revision will take time, and you need to give time because they are a bit tough. And general we are reading it from our MD time, so revising them will be easy and we can revise them fast at the last days. So at the last, if you give 20 days for a revision, you can finish general in 10 days, even if it is comprising of so many systems. General, as in, I mean, apart from your specialty. So you can revise all those systems in 10 days, and you can give 10 days to your specialty.
And as you said, in pediatric hemato-oncology, a significant number of questions are asked from the therapeutic part. The biologicals are asked, monoclonal
Yes.
antibodies, these pharmacogenetics, gene therapies are asked. So, was Nelson and Lenzowski sufficient for that, or you recommend some other source for these books? Did you
No,
read
no,
any
no.
pharmacology or anything? No.
No, sir. Lenzowski is sufficient. Like at the end of the chapter in Lenzowski, they will give newer drugs, and that is what is asked. Like they don't go in detail in newer drugs.
Yeah.
Like max to max, they will ask the mechanism of action or which antibody or what it is inhibiting, CD20 inhibitor, 22 inhibitor. So
Mhm.
just you can just make a list of those things. 22 inhibitor is this, 20 is this. So you can concise them. But I think at the end of every chapter, they give a small paragraph or small topic of new drugs or new trials or anything. So
Mhm.
I think that is sufficient from Lenzowski. We don't need to do any source.
Okay. Okay. So, and you must have given the NEET SS exam also.
Yes, sir.
And what is the difference between you find between INISS and NEET SS? Any significant difference apart from the weightage, of course, the specialty weightage? Apart from that, the difficulty level in general, I think it's same.
So, I think this NEET was at par as INI. Like you can't say that like NEET was more of actual and INI was more of clinical. Now I don't think we can say that because the NEET standard has gone so up and it is so clinical and conceptual that it is like same. If you have worked 3 years nicely, you will be able to solve a good number of questions. So
Yes.
that was for both the exams. That was common for both the exams.
So, Dr. Malav, there will be a lot of students who would be entering into MD Pediatrics first year, DNB first year, and they might be thinking, okay, hemato-oncology is a good field. So, how should I plan my studies so that I crack as soon as possible, or maybe 1 year after doing my MD? So, what advice would you give to your younger version if you have to give?
Yes, sir. So first thing I would see that whenever during your postings, if you see a hemat case or onc case, like you will see pancytopenia under evaluation, you will see a query acute leukemia or a workup case of acute leukemia. So you go up and read that topic at least from Nelson during your MD days. And then if you develop more interest, you can start reading Lenzowski during your MD days, just
Mhm.
for those topics when you see those cases. So that will be relatable. That time you can like avoid preparing like having a core preparation for DM, but just clinically you will be seeing those cases and side by side you can read. So that will be a good start preparation starting for you.
Mhm.
And then once you are done with your MD and with a full-fledged preparation, if you want to start preparation, I think the book to go is Nelson and Lenzowski with a base. You
Correct.
need to be thorough with these two books, and then once you are confident in these two, you can go for piezo and articles.
Hmm. So, Piso article will
But
come after you are thorough with these two books, because there will
yes,
be
sir,
many
you
people
can't.
who will not get time. Many times, most of the
Yes,
MD pediatrics and DNB pediatrics, they are hectic, so we hardly
yeah,
get time to read them. So, I think these
yes,
books
sir.
will be more important, right?
Yes, yes, sir, definitely.
So, Dr. Malav, like obviously it is not a single person's game. Yes, obviously it is your hard work, but there must be other people also you would like to congratulate or give a shout out. So, who
Yes.
would you want to take your names in this video, which will go on the YouTube?
Sir, definitely, sir. My parents, my family is like that was a constant support, and also at a point they will also stress out कि अब कितना पढ़ना है और अब कितना पढ़ना है. So that, but they're always very supportive. So big thank you to them and also to the seniors and juniors at PGI. Like
Yes,
the environment which they gave, and I think the motivation to give the exam repeatedly comes from there. Like
correct.
after working there, you know that what is at stake. So I think the environment which I got there was also very good, and that kept me going.
It is when you initially join at PGI, it is a bit frustrating for you. It is a bit testing for you. But once you are out from there and you look back, I think you feel that all that was worth it. And I think
Yes,
that is why, and I think that is true for most institutions. we all have our affinity for our parent institution from where we do
Yeah,
our MD, especially because MBBS we are more like kids during those times, but MD is always special for us. And it was really a pleasure talking with you, Dr. Malav. And I hope
thank
you
you.
do exceedingly well in the future also. And obviously, you are coming to Chandigarh, so I'll run into you someday in some conference at PGI. So it was
Sure.
lovely talking with you. And the points which Dr. Mallav has given, please, all the students who are listening to this, note down these points, save this video, bookmark this video, not because of me, but because of Dr. Mallav. He has said very beautiful points. There are very little resources available for pediatric hemato-oncology, and he has beautifully exemplified how you can plan your preparation, whatever phase of preparation that you are in. So, congratulations again from myself, from the whole PrepLadder super specialty team, and wishing you all the best. And you can tell your parents that the studies will
Thank you, sir.
continue. Even I study right now, so studies are not going to end. But I think this is the last exam that you have given.
Yes, sir.
No more exams.
No competitive exams.
No competitive exams. Correct, correct, correct. Great. Thank you, Dr. Malav, and
Thank you.
lovely talking to you.
Thank you. Same here, sir. Thank you.